Hello, my name is Aaron Munns. I'm the Veterans Director at the Mesothelioma Center at Asbestos.com, and today I'm going to be presenting some information about VA claims for veterans and veteran service officers to help provide information for filing disability claims for mesothelioma cancer and asbestos-related diseases. The Mesothelioma Center at Asbestos.com is a free help center for anyone affected by asbestos diseases. We have been around for 17 years, and during that time, we connect with about 50% of all the mesothelioma patients in the United States. I have been the Veterans Director here since 2015. I've been a VA accredited claims agent since 2018. I'm an Army veteran. I served 9 years on active duty. And during my time here, I've assisted over 2,000 veterans that have been affected by asbestos, and over 300 with mesothelioma connect with different resources, including VA benefits, legal assistance, medical assistance, and emotional supports. I've also trained over 3,000 veteran service officers across the country in 25 states since 2018. So let's talk about how to get your VA claim approved for an asbestos-related disease. The first thing to know is that nothing is presumptive for asbestos claims. You have to prove that there's a medical connection between your diagnosis and asbestos, and you also have to prove that you had military exposure to asbestos and that it's also the majority of your lifetime exposure. This can be challenging if you worked in a trade after your service where you had a lot of exposure. If this is the case, I can help you frame the wording to show that your exposure in the military, even though the number of years was a little bit shorter, may have still been the majority of your lifetime exposure. There's been a lot of talk about the PACT Act since it passed a couple of years ago. The PACT Act has many presumptive conditions that overlap with conditions that the VA recognizes can be caused by asbestos. If you are eligible for a PACT Act claim because you've served in the Persian Gulf or Southwest Asia, from Desert Storm, Desert Shield through the global war on terror through present, I recommend filing a PACT Act claim. However, if you did not serve in one of those theaters or your service is prior to 1990, you'll file a traditional VA claim providing information about your diagnosis and your exposure, and those claims can be approved as well. There's just isn't anything presumptive about them, and I can help. So here are the conditions that the VA recognizes may be caused by asbestos. The most common condition is scarring in the lungs caused by inhaling asbestos fibers. Decades ago, it takes a long time for those fibers to form scar tissue in the lungs that starts to affect your breathing. Fibrosis, the most commonly occurring is interstitial pulmonary fibrosis, and when it's caused by exposure to asbestos, it can be renamed or re-diagnosed as asbestosis. Pleural effusions, which is fluid buildup in the pleural space outside of the lungs, between the lungs and the rib cage. Pleural plaques, which is scarring on that outer lining outside the lungs. Mesothelioma cancer of that pleural lining, or the lining around the abdominal organs called the peritoneum. And cancers of the lung, bronchus, gastrointestinal tract, larynx, pharynx, and urogenital system, except the prostate. So the VA manual, the M21-1, specifically states that asbestos is not a primary cause of prostate cancer. If you have an asbestos lung disease, it can cause the reduced lung capacity, causes added stress on your heart. It can cause pulmonary hypertension and heart disease secondary to a lung disease. This condition is called cor pulmonale, and if you have this condition, you can receive a 100% disability rating from the VA. So how do you get the right diagnosis? The first step is talking to your doctor about your exposure to asbestos. Most doctors are not concerned with what caused your breathing condition or what caused your cancer. Their primary focus is on treating your symptoms and trying to cure you. But if you don't tell them about your exposure to asbestos, they may pass off your symptoms or your diagnosis to more common causes of these conditions. So you need to talk to them so they do the right testing. For an asbestos lung disease, the gold standard for diagnosis is a CT scan with contrast. You'll also have a pulmonary function test with spirometry, which measures your overall lung capacity. The VA uses that PFT result to determine what disability rating you receive for a lung disease based on how much lung function has been taken away as a result of that disease. You want to see a pulmonary lung specialist, a pulmonologist, because they can diagnose an interstitial lung disease or a restrictive lung disease caused by asbestos. They can also differentiate if you've already been diagnosed with COPD, which an obstructive pulmonary disease, which is typically not caused by asbestos. They can differentiate between a COPD effect on your breathing and a restrictive lung disease or interstitial lung disease. It's very common to have both COPD and pulmonary fibrosis at the same time. You can still receive a disability rating from the VA for an asbestos lung disease, even if you've already been diagnosed with COPD or have a history of smoking. For any type of cancer related to asbestos, to get approved, you'll have to have a tissue biopsy, which states the specific cell type of the cancer, and that will be stated on the pathology report. You'll also need a Nexus statement from your oncologist stating that in their professional opinion, they believe that asbestos is a contributing cause of the cancer. For body parts, for the gastrointestinal tract and urinary tract, for those cancers, the oncologist will typically refer to if there's any sign of an underlying asbestos lung disease like pleural plaques or pulmonary fibrosis as a way to show evidence that bladder cancer or stomach cancer, gastrointestinal cancer is linked to asbestos because there's also evidence of asbestos damage in the lungs. When the doctor is writing that Nexus statement, the VA requires them to say that there's at least as likely as not that asbestos is a contributing cause of the condition. And that translates to there's a 50% chance or more that your diagnosis is caused by, at least in part, by exposure to asbestos. And as I mentioned before, we want the doctor to refer to scans, to the pathology report of other existing asbestos-related illnesses like that underlying lung disease. And also we'd like them to state that your diagnosis is consistent with the latency period of exposure to asbestos during your service. So if you're diagnosed with lung cancer 40 years after your service, the doctor can state that this particular diagnosis is consistent with the latency period of asbestos diseases during your service in the Navy 40 years ago. This can help cement the connection between when you were exposed in service and your diagnosis for VA benefits. Once you have a Nexus statement, the next step is to provide information about how and when you were exposed to asbestos during your service. So the point to remember here is do not assume that the VA knows anything about how you were exposed based on the branch of service, the locations you served at, your MOS or military occupational specialty, or your job rating. Provide as much information as you can, a detailed summary of who, what, when, where, and why you were exposed and how you were exposed, referring to specific duty locations, ships that you served on if you were a Navy veteran or in the Coast Guard, specific equipment you worked on, if you worked on wheeled vehicles, tracked vehicles, rotary wing or fixed wing aircraft, or other equipment that contained asbestos, you want to refer to those specifically in the statement to show that you had direct exposure to asbestos materials. If you have buddy statements or pictures, obviously include those as well to help show the VA rating officer, who may not be a veteran themselves and may have very little experience with the equipment or the conditions you worked in, help them understand how and when you were exposed during your service so they can come to the right conclusion and connect your condition to your service. Couple of key phrases that I put in all exposure summaries is that you were never informed about the dangers of asbestos and weren't provided with any protective gear or breathing protection during your service. I also use a sentence directly from the M21-1 stating that many people with asbestos-related diseases have only recently come to medical attention because the latent period for development of disease due to exposure to asbestos ranges up to 45 or more years between first exposure and development of disease. This is important So the VA doesn't deny your claim, stating that there was nothing on your active duty medical records complaining or diagnosing you with an asbestos-related disease. You want to show that these diseases are diagnosed decades after your exposure and